Okay, we got our shoulder CPM all put together. I've already run it through a range of motion with my arm in it. Now we're going to, before we get the patient in, we're going to put the patient kit on. The patient kit consists of 3 pieces. A piece that goes around the hand grip, which if the patient doesn't, I've had patients that don't like that, and they can take it off. The second piece, or one of the 3 pieces, is this piece that just goes over this already padded area, but this just adds to that. Now, some of the CPMs don't have this pad on any longer, and then this really serves a good purpose of padding this elbow piece. And finally, the piece for the forearm, which I always like to have the strap to the outside. I think it's just easier for the patient to reach it when it's on the inside. On the part that goes down onto the orthosis, we have 2 inner straps and 2 outer straps. So we're going to take the 2 inner straps and we're going to feed them through the inner slots and attach them together. And now we'll take the outer strap and that outer strap, feed them through the outer slots and attach at the bottom. And then we'll leave that strap just hanging out loose out to the side. The patient can just pull that and attach it to the Velcro from the outer straps, okay? Now, once we get this set, if you're post-oping the patient, obviously you're going to need to get them in the sling, and you're going to need to give them some time to get into the machine. We always would like to start with the machine at its lowest point. So I want to make sure that I have my machine all the way down close to or at its lowest point, which we should be fine right there, okay? Now what I'm going to do, and if you're pre-oping the patient, I like to explain to them, obviously they need to take the sling off, and I like to show them how they get into the CPM. For most patients, when this machine is set up properly, this orthosis kind of slides out a little bit to the front. For most people, they can kind of angle themselves in. They're going to support the arm with the off arm. They can angle themselves in and scoot into the CPM. They want to use the off arm to guide the shoulder, the arm that they had surgery on, into the orthosis, and then they can square themselves in the chair. Okay? If you have a wide patient, they can push the lever on the side here, and they can move that off arm out of the way so that they have more room to come on into the machine, and then again position their arm, and they can always reach back and move their off arm rest back into position. And when they want to get out, they can reach for the lever, swing that out. We're going to use the good arm to bring the arm and support the bad arm, and up and back into our sling.